all, welcome back to Nursing Guru. So we are back with another session, and you people already watched our previous videos that which is we have taken on first unit in Nursing Foundation. Happy to see you guys in our classes and make it easier with Nursing Guru. Make your learning with easier with Nursing Guru. Okay, today we are going to discuss about the continuation part of the yesterday class, that what you have discussed in the yesterday class. I had discussed about the health and illness continuum. I will just give a one small recap of it. Okay, so it is a graphical illustration of health and wellness. Okay, so here the next slide you can going to see the diagram of the health and illness continuum. Before going to that, I will give a recap, which is health and illness are going to be placed in opposite ends of in the form of arrow marks. Okay, so it is wellness is based on this highly well-being is also based on our external and internal factors, how the man or human being has to be going to be change externally and internally. Okay, so based on your activity, everyday activity, lifestyle, our wellness and our health will be going to be depends on it. Okay, understanding what I'm saying. So both are kept in opposite ends. So here it is going to be tells about a high level of health and death. Okay, high level of wellness and death. Why? Because those are keep on changing factors. Okay, it is a dynamic process. Health is a dynamic process. Health and illness is a dynamic process in which it is a keep on changing its nature. Okay, so sometimes you will be feel so healthy, and suddenly due to your lifestyle and other activities which you have taken place, that will make sure you to affect on your health. Okay, either it may be in a various ways. Okay, physically, mentally, emotionally, spiritually. Okay, let it be. The next one is composed of two arrows pointing in an opposite direction and joined at a neutral point. Okay, here it is a neutral point will be there. Here there is nothing changes which will be we can see in the health also, in the illness also. But when it comes to this one, right, opposite ends, one end always this left side. Okay, the left side which is going to be in the form of a treatment paradigm, and the right side which is travels toward the high level wellness paradigm. Okay, so this is how it will be there. Understanding, right? Okay, next we can move towards the diagram. So here you can see in the yesterday class we didn't put the diagram, so today I have kept this one. You can see over here the treatment paradigm which is in the left side. Okay, so which is in the left side, and here you can see the right side high level wellness which will be there. Okay, so here, this illness paradigm or the illness side, what you can see, disability, signs and symptoms. Okay, so when it will be occur, signs and symptoms and all, by the time you are in the mode of treatment paradigm, yeah, you are supposed to take the treatment to cure your disease condition. Okay, so that those kind of things are very important. Okay, and which is going to be pushed towards your premature death. Understanding my point? So always illness will going to leads to the death. Okay, so and when it comes to the wellness paradigm, here you can see awareness, education, growth. Okay, so you have to get the awareness regarding your healthy habits. Okay, that is very important. And the next one, your education is very important towards your healthy lifestyle and how to maintain your health properly without making any kind of unwanted habits. Okay, like alcohol, tobacco consuming. Okay, so these kind of things which will make going to be sure you are going to travel towards the illness and you are going to be reach the premature death. Okay, understanding my point? Next we can see the neutral point. Dear students, here you can see that neutral point. Here there is no December illness or wellness. Okay, so you can't able to see any fluctuation or the variation between the illness and the wellness. Okay, understanding? This is all about we can see in the yesterday class I have explained in detailly what about this one, so you can go and watch it also. It's a small recap about this. Okay. The next one is movement towards the right arrow achieved in 3 steps. Okay, so that is what I have said, that awareness, education and the growth. When it comes to awareness, person should be aware towards his health and health status and does not neglect any warning signs of illness. Okay, for example, you are going to you can see here indulgence in physical exercises to prevent any diseases or identify the signs of obesity and then starting the physical workout. Okay, so that is what the awareness. Okay, so next we can move towards illness continuum. Illness continuum is which is going to be, already we have taught you that it is all about the treatment paradigm. You can see over here how you can able to achieve this one. Means if you are prone to the infection or prone to the disease condition, by the time you can going to see that signs and symptoms, occurrence of the symptoms, and you can see the disability over here. Okay, inability to do the function. So this is all about that one, and now we can move towards the factors which is going to be influence the health. Okay, which are the factors? Those are office. So you can see here, that pen. He muted. So here you can see that which are the factors which is going to influence our health. Okay, so very first we will come with the income and social status. Okay, so here you can see income and social status. Higher income and social status make sure you are getting a better health to maintain your daily needs. Okay, basic needs are very important, so for that reason you have to be maintain a very good economical status. Okay, so if you have money you can buy it good healthy foods, for example. Okay, so that is why it is very important, and environment is also very important. If you have a money you can lead a quality life, understanding. Okay, so you can see here. Okay, the greater the gap between the richest and the poorest people, the greater difference in the health. Okay, so for example, poor people can't able to offer every day plenty of fruits or plenty of good healthy foods. Why? Because there is a lack of money. Okay, so low background of the economical status, so that will make sure the difference between, or that will create the gap between the health status of the poor people and the richest people. Okay, so that is why financially make sure you are stable should be, maintaining the stable is very important. Okay, stability, financial stability is very important. Okay, so that is also one of the factors which is going to influence your health. Okay, so you can see first one. Okay, first one is this one. The second one, here you can see The education, yes, very important factor. Low education levels are linked with a poor health. If you are not having a proper education on your nutrition, on your healthy lifestyle, or any factors which is going to be influence your health, means you should have an education. Why? Because if you are not having a proper knowledge about your health, definitely you are prone towards the premature death, which we have discussed in the health and wellness, illness and the wellness continuum. Okay, so there we can see, so that is why. And poor health and more stress and lower self confidence, very much important. If you are not having a proper confidence, yes my dear students, the health is always between our mental status and the physical status. If you are physically fit, your mental ability will be going to be act like anything, right? So for that reason, education. If you are prone to obesity, you are feeling that you are gaining up, put on your weight, means kindly go and join the gymnastics, or you can perform any kind of home workouts also to lose your weight, and that will make sure you to fit and fine, and that will boost up your confidence level also. So that will make sure you to increase the self esteem of your person. Okay, and it will build a personality also. Okay, so that is why education is very important, and which will make sure to reduce the level of risk of unhealthy disease conditions. Okay, so if you are too much of obese, you are going to prone to get early arthritis and those kind of chronic illnesses, diabetes mellitus, everything. Okay, nowadays we can see 37, 30 plus, 35 and younger children's, we can see the diabetes mellitus. Okay, I have seen lot of patients in hospitals, they are prone to diabetes. Why? There is a improper lifestyle management. Okay, so that is and all will be the affecting factors. So influencing factors are education. Okay, the next one is physical environment. The physical environment is that safe water and clean air, healthy workplace, safe houses, communities and roads all contribute to good health. Okay, so maintaining a proper drinking potable water in your home and cleanliness, this is very important. You have to clean your kitchen, your area, wherever you your surroundings, your environment should be clean, your mood should be clean, and your if you are very maintaining a cleanliness in the home, means definitely you are away from the disease conditions. Okay, so that is why physical environments are very important to obtain a good health. Okay, next we can move towards factors influencing the health. Okay, so here you can see the continuation part is that the social support networks. Okay, what is the social support networks? It may be your families. See, if your parents if you think that you are obese, your parents will tell that you want to join gym. By the time your parents will tell that no need to go gym and all, it is not going to be lose your weight and maintaining your physical fitness, or else you can't able to maintain your health properly. Okay, so that is why for everyone supportive system is needed. That supportive system which is held by your families, friends and the communities linked to be your health. Okay, so that is very important. Next one we can see that the culture means whatever the culture you have maintained, whatever the culture or the tradition, custom, beliefs of the family and the community, all will be matters in your health. Okay, so what kind of cultures you are following, that is also influencing your health. Next one we can move towards the genetics. Okay, so the genetics, the hereditary, we can say that the inheritance plays a part in determining the lifespan. Okay, so the lifespan as well as healthiness and the likelihood of developing a certain illness. Okay, here you can see that how your genes should be. Okay, so same, that is going to be the inheritance, going to be influence your health also, and it is going to be decide your lifespan also. Your ancestors are maintaining a good health, means you also getting the good health from them only we are getting, right? So that is why this is genetics also going to be matters here. Okay, next one. Next thing is that health services. Okay, so health services are very important. If you go abroad, you will get fever today, means you will get the appointment after 1 month. Is this good for your health, to maintain your proper health? No. So either it may be a certain occurrence of the disease condition, or it may be a chronic occurrence. You need a follow up care, and you need a sudden care. Okay, so that is why you have to be in the area wherever the essential healthcare facilities are available. You can see the access and the use of services that prevents and treats the disease influences the health of an individual. If you can't able to get the proper care at by the emergency time, or for the treatment of your certain conditions immediately, definitely you are going to get like complications of the disease condition. So in order to avoid that one, you have to utilize the health services. See, prevention is better than cure. Okay, nowadays wherever you will go, we are promoting healthcare professionals as a nurse, as a doctors, peoples are promoting the preventive care kind of treatment. Okay, the preventive and promotive and curative care nowadays providing in India also. So that is why you have to get the benefits of the healthcare services in order to curb the complication of your health. Okay, next one, gender. Okay, so the gender also, it may be because of the most of the things we can observe that both the men and women are going to be suffer with various kinds of disease conditions. Okay, so for that also gender also matters a lot. Okay, so why? Because usually the man will prone to addicted to the substances like alcohol, tobacco, that and all. For them, I'm not telling that women are not doing all those things. They will also do, no issues in that. But even more people, the ratio we can take, boys will do more. Okay, so for that there is a chance to get various alcohol syndrome or another kind of disease conditions, which is liver abscess and all, due to this substance abuse only. So those people are very prone to that one. Okay, so by the time gender matters a lot. Okay, so your gender also influencing the health factor. Next thing, you can see here illness. Okay, so illness is one of the very important topic. Just a second. Okay, so see my dear students, this is one of the very important topic in this particular class. Okay, so still now we have discussed about the health factors which is influencing the health. Okay, so all those things you have know now. Okay, now we are moving towards the important concept of the entire unit is illness. Okay, so let us discuss this one, illness. What is illness? What you are going to be know. Okay, so in easy form we can tell that illness is a disharmony between your body and the mind. Okay, so there is not a proper connection between your body and mind, we will call it as a illness. Okay, so now you can see the definition over here. Illness is a condition in which the person feels unwell in body or mind. Okay, so you can see here, body or mind. Cannot perform normal activities. If you are supposed to prone to the fever or any kind of sickness, you can able to, if suppose a person is having stomach pain or any kind of cold, fever, okay, common disease like signs and symptoms of any unhealthy activities, by the time the person can't able to work productively, or you people can't able to do your normal day to day activities also. So that will make sure you to feel that you are unwell. Okay, so by knowing yourself only, you are going to understand that I can't able to do this one, I am feeling so low. Okay, so your self concept, self esteem were going to be down. All those things were going to be affect on your body and the mind. Okay, so that is why I said that it is a disharmony between the body and the mind. Okay, so here also you can see that the condition which is a person feels unwell in the body or in the mind and cannot perform normal activities. Okay, understood? So this is the definition. You can remember in a short line. I have given here short line to remember also. Illness is equal to feeling unwell plus not functioning normally. Okay, you may feel that you can't able to do any function in the day-to-day life. Okay, suppose yesterday you were doing everything. Okay, your normal function that you are fresh up, you are taking bath, work you will do by yourself, right? So that also can't able to do. Okay, you may get the illness. Okay, so you can remember that now. Here you can see illness is equal to feeling unwell plus not functioning normally. Not functioning normally. Okay, don't forget this one. Okay, so what kind of changes we can see then? Why madam is always telling illness is that you can't able to do your functions properly? Why it is? Because you are getting any kind of infection in your body. Okay, so that will going to alter in your brain also. Okay, so now we can see that the normal changes in the normal function can be mild or severe. It affects the body or mind and may need to treatment or care. Okay, so first gradually you can see the functions changing in the functions, normal functions of your day to day life. Then after it can be mild symptoms or severe kind of feelings, unwell feeling you can observe, or you can, what you can say, you can feel it. Okay, the next one is affects the body or mind. Definitely if you are getting any kind of illness means definitely it is going to affect your body and the mind. Okay, the next one is may need to treatment or care. Okay, which needs a treatment or care. You are going to, you are supposed to take a care and the treatment to reduce your signs and symptoms. Okay, so next thing, yeah, now we can move towards the types of illness. Okay, so the types of illness are like based on the physical illness and the mental illness, and the next thing is that based on the duration. Okay, so two types categories will come. Okay, so here you can see the normal thing is that physical illness and mental illness. So physical illness, which we can give an example of fever, cold or any kind of physical injury. Okay, so don't be confused with that. Physical illness which is going to be affect your body. Okay, physical means body. So here what it will be happen, you are going to get the fever, alteration in your body temperature, or else you can get the cold. Okay, so that is also the level of temperature will be very low. And the next one is injury. Okay, so I don't know why hydrogen came here. Okay, injury. Okay, injury means any kind of accidents or any kind of sudden fall which may leads to fracture of your bones, or any kind of disability which may leads to the disability to do the function. Okay, so those kind of things which will be comes under the physical illness. Okay, so do watch my video in normal range. Okay, so next thing is that I can tell you mental. So mental illness tells about that stress, anxiety, depression. Why it will come means, if you are not maintaining a proper lifestyle, definitely you are prone to get the stress and anxiety and depression. Why? Because you are not getting a proper sleep. Okay, this is the main factor which is going to be affect in your day-to-day life, whatever it may be there, whomever it may be there. So maintain your sleep cycle properly, otherwise definitely it is going to be affect on your health, sudden rise of your weight gain. So all these problems which will be getting by avoiding the sleep only. Okay, so you have to maintain your sleep properly. Okay, so these are the common two types. Okay, so common, very common, you can remember and write it in your exam also. Now we can move towards the important types, which is comes under the types of illness based on the duration. Here you can see, based on the duration means how long the disease condition, how long this illness is going to be stay in your body. Okay, so how long it will takes time to cure. So that is how we are going to be like categorize the types of illness. Hope you students are understanding this one. Depends on the duration of the or the period of illness or the period of disease condition, we are going to categorize into two different type of illness. First one is under that one acute illness, and the second one is chronic illness. Acute illness, here you can see acute means this short duration. One second. Okay, see students, here you can see acute means short duration. Okay, for example, short term example is fever. Fever will come if you take a Dolo 650 paracetamol, or if fever will be too much means you are going to be get administered by PCT, paracetamol infusion. Okay, so definitely it is going to be reduce the temperature level in our body, and definitely you are going to be cured with 1 or 2 days. Okay, so the next day you can go to the college. Okay, so many people are telling that every time headache, fever and all, no, so those kind of things which will be comes under the acute. I saw in colleges people are coming and telling that, ma'am, headache is there, ma'am, fever is there, small temperature rise will be there in your body. You people are telling that, ma'am, fever. Before and all you will enjoy very nicely, but even though you people are doing this one after joining nursing, I don't know why you people are doing that one. It's okay, let me continue this one. Okay, acute illness means, my dear students, it is a short term disease condition. So we can cure it fastly, we can treat it fastly. If you treat it by a good treatment, definitely you are going to be cured within a short term duration only. So that makes sure you to, as usual, how once it will be cured you can work productively, no issues in that. Okay, so next type is that, one second, chronic illness. So chronic illness means it is a long term. Okay, long term. For example, diabetes mellitus, once it will come till your last breath, you are going to be keep on monitoring your, means if you have experience, means best example is your grandfather, grandmother, both are, or sometimes the elderly people are prone to get the diabetes nowadays. Everybody is getting, that is another thing. But even though those people are getting this one, means they are prolonged duration treatment they used to take. Okay, so for that reason we will call those things as a chronic. Okay, so once again I will repeat, acute means short term, chronic means long duration, more than 6 months it will be take. So sometimes, for example, like diabetes, lifestyle disease condition means definitely it will take too many years. Okay, people used to say, no, 15 years I got diabetic, grandparents. So that is one. Okay, hope you guys are getting this one, the difference between the acute and the chronic. My dear students, you have to understand this one, right? Why? Because it is very important. You are a fresher, you should know about this one. Okay, so these are the terminologies also, a special terminologies. In next thing, what it will be there, the acute management. Okay, sudden management. Acute means sudden. Okay, so those kind of words which we can use in the further classes, by the time you should not knowing the meaning, like that kind of confusion should not be there in your brain, okay, mind. So for that reason I am keep on telling you acute means short term, chronic means long term. This word you remember. Okay, let us move to the next topic. So the next topic also we are going to discuss about the acute illness. Acute is a condition characterized by a sudden onset of the symptoms and a relatively short duration and rapid course. Okay. So this one is a sudden. So, acute illness is a condition characterized by sudden onset. Here you can see. Okay, sudden onset of symptoms, a relatively short duration. Okay, again we are seeing here short duration, within very short duration. Suppose today fever will come, tomorrow definitely we are going to be get cured by while taking a simple medicine like Dolom 650. Okay, so that is why it is a very short duration and it can be cured it also. Okay, a rapid course which may be severe but usually resolve completely with or without medical treatment. Sometimes with or without medical also we can like medicine also we can cure it. Okay, so that is why acute is a very short. Now we can move towards, see, for here I can give you a hint or a small tip to remember this one. Sudden onset plus short duration plus quick recovery, we will call it as a acute illness. Okay, acute illness. What you can say? The next one is short term. Okay, so already here it will be there, short term. For example, fever is the example for the acute illness. Okay, hope you guys are clear with the acute illness. Next we can move towards the chronic illness. Okay, the chronic illness is a long term, short term and long term. Okay, so opposite words you can remember like that also. So chronic is a long term condition that develops gradually and persists for an extended period. Okay, so that is going to be gradually increase the duration of the disease condition, which may going to be increase the rate of incidence of the disease condition also. Means how it is going to be increase means suddenly if you are got a diabetics, okay, initial phase you are getting one range, after you are taking, you are not like you are not taking a proper medications or the proper treatment, you are not monitoring every month or every 3 months once, so definitely it is going to be gradually increase the graph of your sugar level. Okay, so that is how it is going to be there, and often for a months or years. Okay, it may be often for a months or the years. Okay, the next one, and modifications and continuous medical care as it can affect a person's physical, mental and social well-being. Of course, definitely it is going to be affect the physical health of the person, mental health of the person and as well as the social health of the person. Okay, so for this one I will give you a tip, that is what the gradual onset plus long duration plus ongoing management. Okay, so gradually it will come, after that what it will be happen, long duration it will take, and ongoing management, you have to take a treatment for so long time. Okay, so it is keep on going with the management of your disease condition, how you will care, that is how it will be react with your body. Okay, so it is a tip to remember this one. Okay, here you can remember this one as a long term also. Okay, so acute means short term, chronic means long term. For example, diabetes. Okay, chalo, next we can move to the next topic. So here you you can see that acute illness are the short and sudden, while chronic illness are long lasting and require a continuous care. Okay, so that is what the difference between those kind of two type of illness. Okay, so you will never forget this one for sure. If you listen my classes, definitely it will better, you make sure you will remember at last also. Okay, so why? Because it is very easy unit, and using your daily terminologies and all every day, definitely it will make you to remember easier. Okay, so better students, you have to revise it for a while, once in a week. Definitely it is going to be more helpful for you. Okay, next we can move towards causes and risk factors of illness. Okay, so what are the causes which is going to be a cause a illness in our body? Everybody is a healthy person, then why people are going to be hospital? Why the healthcare services will be there in our nation or worldwide? What is the need of that? Okay, so always I said that illness and the wellness will be always in a fluctuating process. It is not a simple, it is not a static, it is a dynamic process. Always the heights and troughs will be there. Okay, sometimes you will be so healthy, sometimes you will be very unhealthy. Okay, you are sick, you are prone to be disease conditions. Either not only same thing, those factors, what are the causes, that we are going to see now. Okay, so the very first we will come with the physiological causes. Physiological causes means physical causes. Okay, so how it is going to be physiological causes? Those causes which are definitely going to be affect your body only. Okay, understanding? So here you can see infection. Okay, one second, you can see here infection. Infection. So infection usually we are getting from the bacteria or the viruses. Okay, remember coronavirus. Okay, so infection which is going to be enter into our body. For example, tuberculosis due to the Mycobacterium tuberculosis, the bacteria which is going to be affecting your lungs. Definitely your lungs is going to be damaged, you are getting the tuberculosis, right? So infections which will be occur by the bacteria, that is also one of the cause which will be comes under the physiological causes. Okay, understanding where we are studying? We are studying the causes and risk factors of the illness. Very first we will focus on only causes. Okay, only causes we are focusing on. So in the first cause we are seeing the physiological causes. Okay, so when it comes to the physiological causes, infections, okay, which will be acquired by the bacteria or the virus. Okay, the next one is injury or the trauma. Okay, so injury or the trauma which is due to any kind of accidents, or it may be due to the sudden fall. Okay, understanding what I am telling? So that will going to be affect your body only. Okay, suddenly you will fall, you are going to be broke, like fracture your hand, means whose body you are going to get the affection. Okay, so this is also injury or the trauma is also one of the cause to get the illness. Okay, so the next one is genetic factors. Okay, sometimes in mutating genes and all, what it will be happen, or due to the consanguinic marriage, there may be a chance to give a birth for the mentally retarded children. Okay, lot of people we are seeing in our places, means in our surroundings only, in the society we are seeing this one, due to the genes also supposed to get this one. Okay, so example I am giving. Okay, so that is why genetic or inheritance is also one of the factors which may going to be reason for the getting the illness which is going to be affect your body. Okay, the next one is poor nutrition. Okay, so the poor nutrition, intake of the unhealthy foods like junks, alcohol, that, this and all unwanted foods, definitely which is going to be affect your health. Okay, it will leads to illness. Okay, that is also one of the reason. And organ dysfunction, you are very much intaking of the alcohol. My students are very good, I know. You people are not going to take any kind of alcohol and all, but you can see that people are taking, yes, in our India so many people are having the alcohol. So for that we can't able to do anything, no issues in that, but that may leads to the organ dysfunction. Okay, so organ dysfunction which will be happen, only I am giving a one small example is a alcoholism, which is going to be damage our renal system, which means kidney. Or if you are having a habit of smoking, people are prone to have a smoke every day, definitely they are going to get the tuberculosis or any kind of lung related disease condition, asthma, okay, then bronchitis, emphysema, COPD. Okay, they are very prone to get those kind of infections or the disease conditions. Why? Because of their activities. So there may be a chance to get the organ dysfunction, or else if your organ is not functioning properly, that is also one of the reason to get the illness. Okay, not only that one, pancreatitis. Okay, so any organ. Next one, we can see the psychological causes. This is very important. All nursing students are always having the stress. Why stress? Stress is because of assignments, your requirements, and you are doing lot of work in the clinical area also. Don't bother about that one. Okay, so today is a very big busy day, tomorrow is a very quite calm day. Okay, so always you think in a positive way and do your work. Okay, if you finish it off in an initial days, definitely it is not going to be burdenize you. Okay, so we can see this one, psychological causes which is going to be affect your mental health. So the first one is that stress. Okay, don't take too much stress. And anxiety is also one of the thing. Depression, currently high yielding topic is depression, so don't bother about that. Depression is also one of the, so if you think that whatever, so sometimes what it will be happen, if you lose your girlfriend, if you lose your boyfriend, there is a chance to get the depression. Okay, or else if you lose your beloved one, okay, or if you lose the thing that when something which is very loving things to you, by the time there may be a chance to get the depression. Or if you lose the job, definitely you will get the depression. Nowadays everywhere we can see, due to the AI in Oracle like companies, so many layoffs are going on. Okay, so but there is no issue if you are having a real skills, if you are having any kind of new ideas, new innovations in you, new skill is there in you, definitely you can survive everywhere. Okay, why? Because I'm telling, nursing students are very much active and they are working in high yielding areas like hospitals, ICU and all. It is not an easy job, I know that. Okay, so for those kind of time you have to know how to manage by yourself with you. Okay, so whatever it may be happen, also take it as a cool. Don't take it as in your brain the something will be happen to me only. Don't take in such a way, definitely it will be affect your health, sure. Okay, so the next one is emotional trauma. Emotional trauma is also one of the very important cause, because nowadays you can heard that the which one, no, you can heard that childhood trauma and all. If your parents are doing fight, and that will make sure you to triggerize in your upbringing, like future. Okay, so that is why upbringing of the children is very important, and wherever you will go, don't be take it as a emotional. Okay, so nothing works with emotional. Okay, if you want to be emotional, only with the good things, no need to be bothered about the losing things and all. Okay, so don't take it that, but I'm telling these are the factors or the causes which going to be leads to the illness. Okay, then poor coping ability, if you can't able to cope up with the proper kind of work or any environment, that will make sure you to prone to get the mental disorders or the disease conditions. Okay, so very first, once again I will repeat with the particular topic, which is like physiological causes which is going to affect your physical health. That is what infection by the bacteria or the virus, or injury or the trauma, genetic factors, poor nutrition, organ dysfunction. Okay, so these are going to be affect your physical health. Next one is psychological causes which is going to be affect your mental health. So that mental health, how it will be affected means due to the cause of stress, anxiety, as well as the emotional trauma, depression, and the poor coping ability with the situation or the work environment or anywhere. So that will make sure you to affect your health. Okay, so next thing we can move. So now we can see the risk factors of the illness. Risk factors of illness are conditions or influences that increase the chance of developing the illness. So these are the factors which may going to influence you to develop the illness. Okay, so let us come, we can see what are those factors which we are really going to be get the disease condition due to those kind of horrible factors. Okay, so the horrible factors are like genetic factors, biological factors, immunologic factors, physiologic factors, age, environment factors, lifestyle, dietary habits, social factors, economic, literacy level, spiritual factors, facility available. Okay, which means healthcare sector, healthcare access availability. Okay, so one by one we can see. You know that the genetic factors means that is always inheritance or the heredity will be going to be the one of the high risk factors to prone to get the or develop the illness with the people. Okay, so the next one is biological factors. Biological factors which may going to be affect you. So we can see biologically. Okay, so the biologically how it is going to be affect you, that is very one of the affecting factors. Okay, biological and behavioral factors. Okay, so there how we are going to be get this one in the biological, either it may be due to the like infections or any kind of things. The next one is immunologic, the immunity within you. Okay, so the immunity, that is also one of the very important factor. Physiological factors, when it comes to the physiological factors, here you can see that include the physical functioning of the body. Being pregnant or obesity places increased stress on your body, causes illness. Okay, so if a person being a pregnant person, you can go and ask, they will show their stress and frustration. Okay, same like that if you are an obese person, definitely you are also going to show those kind of stress. Okay, you are prone to stress, so that will affect your mental status. Okay, the next one, age is also, see, if you are a young age, by the time you are having enough energy, but if you feel that you can observe with the, you compare with the geriatric people, they are not similar with us. Why? Because their age is very high. Okay, so the digestion capacity, okay, those kind of problem will be there for them, and the mobility also very less for them. If like 80-90 people we can take, means they are need a help of somebody else. Okay, so for that reason it is also one of the risk factor. And children's also, when it comes to the childs, there may be a chance to get a sudden injury or the fall in children's. Okay, so that will also going to be get the illness, right, when it comes to the physiological injury and the trauma. The next one is environmental factors, good shelter, drinking water. Okay, so so and so and so on will be there, no? So those also, good environment, nutritions and all will be matters a lot. And lifestyle factors, if you are not having a proper exercises and sleep in every day to day life, that will definitely going to be increase the weight or causing any other kind of disease condition due to the stress, anxiety and depression. Okay, so understand my dear students, these are the factors again and again which is going to be repeat. Okay, so dietary factors, using a heavy junk every day. Okay, what is there in the gobi manchuri and what you people are liking, egg rice and all, no, junk food, pani puri, girls favorite food. So there what it will be happen in this what you can say, in this egg rice and all, there is a presence of ajinomoto, especially in the gobi and all. So that will make sure, if you keep on eating every day, that will make sure build a thyroid and all. So that will affect. So that is why you have to alter your dietary factors. And social factors, which is having a good relationship with the society as well as with the, like you are having maintain one proper kind of things, which is economically you should be stable, and you have to maintain a social, like with work environment and all, you have to be socialized with the people in a minimalistic way. Okay, I'm not telling you everything you should be socialized, but you have to maintain a proper socializing maintenance of your behavior. Okay, so with the society. The next one is economic factors. That's what I told you, money should be the one of the key factors which is going to be affect your health also. If you are not having a proper economic status, that will make sure you to prone to get the disease condition. By very first it will start with the unwanted like poor nutritions. Okay, you can't able to afford for the poor, like proper nutrition, definitely it is going to be get the disease condition. And literacy level, literacy is nothing but the education. Okay, if you have an education on your food day to day life, definitely you are going to be aware of that one. If you are not having a proper education or the literacy level will be very low, means definitely you are going to get, so suppose if you think that a pregnant woman will be there, they are not having a proper nutrition, means of course we are going to be get in our nation malnourished children. Okay, so what you can say, that malnourished children, protein energy malnutrition, marasmus, okay, kwashiorkor, like that kind of various nutritious disorders will be there. Okay, that kind of things you can study in the nutrition also. Suppose give an example. So that is why pregnant woman needs a extra awareness and the education. Okay, so that is why literacy level is also matters a lot. If you go and explain those kind of things with the uneducated people, they will be ignored. Okay, so that is why. The next one is spiritual factors. Spiritual factors are the factors which is going to be purposefully having between one purposeful work. Okay, so if you have a spiritual practice, means it will going to be increase the inner peace with yourself. Definitely it is going to be boost up your self concept and the self esteem also. The next one is facilities available. Okay, so the facilities which we are going to use, means that is a healthcare facility which will be available to you. Okay, don't think that I am fast, you just slow down the video and watch, definitely you are going to be understand this one. If you are fast, means comment it down, we will correct it. So the last end session of this one refers to how person perceives, reacts and responds to the illness. Okay, so here you can see, one second. Includes a recognition of the symptoms and deciding something is wrong. And see, when you are prone to illness, means these factors which is going to be observed within you, so that will make sure you to get the treatment. Influences, the illness always will be influences when and where to seek the medical help. Okay, so always you have to aware of where, when you want to go and where you have to get the treatment. The next one is affected by culture, beliefs and knowledge. And the next one may involve self-treatment or ignoring the symptoms. So these these risk factors are going to be, you can see that okay, I can treat by myself, too much intelligent people will do that one. Okay, the next one is determines compliances with treatment and recovery. Okay, you have to be compliant with your treatment and the recovery. You have to go for a follow up after taking the treatment also. That may make sure you to get a better health. Okay. So this is all about the unit, and within this unit only we are going to see that the impact of patient. Okay, so one more is there, that is what? Impact one second, I will continue. So impact of illness on patient and family. First one is that behavioral and emotional changes. Of course, how it is going to be impact on your family, and if you prone to get the disease condition. If suppose you are getting the any kind of disease condition, for example we can take fracture or injury or any kind of trauma, definitely it is going to be affect on your emotional and the behavioral changes we can see. Okay, so the first one is emotional and behavioral changes. So the next one is that you can see impact on family roles and dynamics is that additional stress on your family, this one. Okay, so that will make sure you to get additional stress on your family members, and financial problems they can face. Okay, so that is kind of things we can see. And next one is that which will be going to be impact on your self concept also. Okay, so how it is going to be affect means we can see that one second. So behavioral changes. Okay, so the behavioral changes and emotional changes we can see in the patient when they are getting the illness. That is very common in every patient or in every family members. So if any kind of unhealthy things which is affecting to your body or anywhere, definitely it is going to be alter your family members. Okay, which will give you additional stress to your family and as well as to you also. Okay, because the illness is going to be entirely alter your day to day life. Okay, so it is going to be dysfunction of your daily activities. Okay, function you can't able to do properly. So the next one is impact on the family's roles and family dynamics. Definitely it is going to be affect on putting additional stress on your family members, and as well as the financial crisis it may leads. Okay, so that will be also going to be affect. The next one is which is going to be affect on that we can say that self concept and the self esteem. Self esteem is very important, which is like either it may come in Maslow's hierarchy of need model. We have see that self concept and self concept is very important, which may comes to the recognition, response and respect will be matters a lot in the self esteem. So that will also there is a chance to lose your respect. Okay, or any kind of self esteem. When it comes to self esteem, then self concept means if you are ill, you can't able to overcome from the illness because of low level of the self concept. Okay, if the patient, for example, we are the nurses, we are boosting up the self concept of the patient, means definitely we can reach the quality of the care, and we can easily make patient to overcome from the disease condition. The curative range will be going to be increased faster than decreased self concept. Okay, so self concept is that what person views about his own strengths and weakness in all aspects of personality. Okay, so if a person can able to analyze his own self, okay, so that will make sure the person to feels better. Okay, then only we can get the outcome. If the person will think that regarding his own personality, I can't able to do that, his self concept will be very low. Initial days of illness definitely it will be low. Day by day how he will be accepting the things. Okay, it is an inner ability of the personality to how to accept the things to make his better future. Okay, so that is what the self concept. Suppose any kind of losing of the body parts. Okay, for example, in an accident he will lose the hand or leg. By the time how he is going to be understand that one, how he is going to be cope up with those stress, and how he is going to be boost up his self confidence and self concept, that will make sure to increase the range of overcome from the disease condition or the illness. Okay, the strength he should need. Okay, that will definitely illness is going to be affect on that. Okay, the behavioral or the emotional changes which going to be impact on the self concept and the self esteem. Hope you guys are understood this one. The next one, impact on body image. Certain illness results in changes in the physical appearance of the patient. The client reacts differently to these changes depending on the type of change. If it is short term change, they will be accept it radially, but when it is a permanent change such as amputation, or that's what I said, so any kind of changes which will be taken in his body, amputation and all which will be adopted by him, means there may be a chance to show the reaction in phases such as shock, withdrawal, or acknowledgement, acceptance, and finally rehabilitation. Like this kind of impacts will be going to be taken down. Okay, so this is all about the first unit. Okay, so if you are having any doubt, comment it down. You can contact our through our WhatsApp number, or you can contact in the Instagram directly. You can DM us. Thank you so much. So if you have any doubt in this particular topic or the particular chapter, you can ask us, and please do follow Nursing Guru. Subscribe to Nursing Guru YouTube channel also. Okay, thank you for your presence.